I'm Mary Eden, and I'm Vice President of Government Programs. And in my role, I have responsibility for our Medicare and Medicaid lines of business. So I always start with this slide because I think it provides necessary context on our state, and it's really the coverage landscape within the state of New Mexico. And you look on the far left-hand side where it says 43% of our residents are covered under Medicare or Medicaid. So if you're a provider, what does that translate to? Low reimbursement, right? Right. So low reimbursement is sort of on the my right-hand side of the screen. And you'll see that New Mexico ranks second in the country in terms of residents covered by Medicaid, and 8th for residents covered by Medicare. So the middle are the percentage of New Mexicans that are uninsured. So this is down dramatically. And prior to Medicaid expansion, it was in about the 20 to 22%, very significant. We were, again, #1 per capita in the uninsured rate. And this is precisely why it was a good decision for the governor to make to expand Medicaid, because we are now covering more New Mexicans under the expansion population. And then on the far right-hand side, the 37%, I mean, those are the individuals that receive their health care coverage through an employer. So your employer is providing a portion of your health insurance coverage. And the remainder, the sum of that, are individuals that buy individual products or are covered by other public entities. So the bottom is really important when it says, in New Mexico, we serve a population, we collectively, so that's the royal we, serve a population that has more Medicare and Medicaid lives and fewer commercial lives than in other health insurance markets. So some of you may know this information or might be enlightening to some of you, but I think it does provide the context that is necessary because it explains why Medicaid has such a big footprint in the state and why the policies that we see come out of Santa Fe really do impact your practices. So how many of you have heard about the state budget issue? You all have, right? I can't imagine nobody's heard about this. But let me just explain to you a little bit about the 2017 budget. The Medicaid budget total, the whole program budget for 2017 is $5.8 billion. $5.8 billion, very significant. And again, as I explained, the contribution that's coming from the federal government is very significant. 80 cents of every dollar comes from the feds, and the state puts up the 20 cents for every dollar. As we were working our way through this last legislative session, the news emerged that these persistently low oil and gas revenues had caused a strain and caused a very significant gap in the state budget overall, with Medicaid being a part of that. And when you couple that, kind of that news, because we're very dependent on oil and gas revenues in this particular state, when you couple that with what we have seen with expansion, so these are the numbers, sort of the jumping off point. 575,000 people were enrolled in Medicaid prior to Centennial Care. So that was like on the 31st of December, 2013. 1 in 4 New Mexicans were served by Medicaid. As of July, you see this number, 872,487 people are served by Medicaid. It's now 1 in 3 New Mexicans. So you see that significant growth. I just attended the Medicaid Advisory Committee yesterday. We're up to 877,000. So it continues to grow. And when you look at the bottom, I mean, where they're projecting that Medicaid will be in terms of the number of people that this program serves, 925,000, 1 in 2 New Mexicans, so half. So the person either to the left of you or to the right of you, pretend, are going to be on Medicaid next year, if you think about that. So that is significant. That's a significant number of our state on Medicaid. And so where they emerged at the end of the session was that the Human Services Department budget was underfunded in state general fund. So when I talk about state general fund, that's the 20 cents of every dollar that the state contributes. So they were underfunded by $86.5 million for their upcoming budget year. So that means they lost the federal contribution of $330.5 million. You don't put up the 86 million, you don't get the 330 million. So the total program impact is 417 million. And that's what you were seeing on the news, that's what you were hearing about when they said we have to cut Medicaid by 417. It's that amount. It's the sum of the state contribution that wasn't matched, and now we have to pull that cost out of the Medicaid program. So House Bill 2 is the state budget bill. And the state budget bill, how many of you know that it contained this explicit, so I put it in quotes, because I was in a legislative hearing, the Legislative Human Services meeting interim committee about 2 months ago, and they were literally grilling the secretary about why they were rolling out provider payments and asking him what's the impact to access and do you know how detrimental it's going to be, and they were asking him, I think some way about maybe an hour in, after everybody was asking him, somebody must have sent the chairman a text that said, psst, you guys put it in the budget bill and passed it as law. And so it was funny that he said, oh, I guess we told you to do it. And he said, so we didn't read it, evidently, which we've heard that before. But what it says is the department shall reduce reimbursement rates paid to Medicaid providers in managed care and fee-for-service programs. These reductions may include, but are not limited to, rescinding the primary care physician rate increase first initiated under the Affordable Care Act, and reducing rates, reducing rates paid to hospitals, including safety net care pool hospitals. The department shall reduce spending on managed care administrative costs. So they did that with us. They reduced our administrative, what we can spend on administration, by 1%. And so then you see the next provision, which is that the department shall explore options that would require them to pursue federal authority to include cost sharing. And there's a lot of sensitivity around that. There's the camp that says, you know, it's part of personal responsibility, but there's also the belief that this is an underserved population, low-income population, and if this is not collectible, it can translate to another impact to providers. So really, that's a subcommittee that's at work right now, but no recommendations have come forward at this point. I will also say that there are prohibitions, there are federal prohibitions about the imposition of cost sharing for certain populations, for certain services, like services for kids, EPSTAT services, Native Americans, you can't impose. So really it takes the broader population, and when you include all of the exclusions, it's a very narrow population to which you can apply cost sharing. So we'll see where this goes. In September, the state will be submitting their budget for the next fiscal year. It's the version that will be vetted through this next legislative session, and they're anticipating that it will be fairly significant gap as well. So remember, under expansion, the program was going to be fully funded 100% by the federal government for the first 3 years, and then it begins to decline. And so we're into the beginning of this decline. Fiscal year 17 has a half a year of the decline, where 18 will have a full year. So that's another compounding effect, that you have the program growth, the growth overall in healthcare costs, the aging population that's costing more to care for, and obviously the decline in the federal match for the expansion population, which the Medicaid director reported yesterday is 32% of all the enrollees now fall under the expansion populations. Very, very significant. It grew in 2.5 years to that number of individuals. So what I want to say, and this goes without saying, we couldn't do this without our providers. We could not serve our members, we could not deliver the quality care that you deliver through your practices without this partnership. So really our commitment to you is to provide timely and transparent communication on things that affect you. You know, we sent out a number of communications about the provider rate cuts because we were sending it out as we were receiving it. And we didn't let the grass grow under our feet. In fact, we had the messaging teed up and we were waiting for the publication of the formal notices so that we could make sure that our messaging was accurate and aligned, and then we immediately sent it out. And those of you, I hope you can attest that what you received said, you know, here's some more information and we just got this, because it's important not to hold on that until it's absolutely fully developed, but to tell you so that you can be prepared and you can start your planning. So with that, I'll come to the end of my, my time with you, and it's been a pleasure to share a few minutes with you, give you an update on what's occurring in the Medicaid world, and welcome any questions that any of you might have.